Esther Rantzen, who is dying of terminal cancer, has lashed out at Wes Streeting, the Health Secretary, saying that he is forcing her to fly to Dignitas to die alone after he said he would vote against the legalizing assisted dying legislation. This was, of course, a change on his previous position. Let me bring the bombshells back in now. Amy, Jemima, and Fleur Elizabeth. Fleur, I know you're very passionate about this one. What do you make of Esther Rantzen's comments and her fury that Wes Streeting, as Health Secretary, has made this decision?
She kind of reminds me of Veruca Salt from Charlie and the Chocolate Factory, stamping her feet and saying, like, I want my own way, and I want everything my way now just because I want it. Whereas Wes, he's the health secretary. He knows what the state of the NHS is, and he has said that palliative care and the NHS are not in the right state in this country to bring this in right now. Even though he is personally supportive of the principle of assisted suicide, but Esther just sees what she wants, and she wants the choice to end her life how and when she wants it. And I'm sure she is mentally competent enough to do that. She's said that she's joined Dignitas. But what that doesn't account for is how many people may not be mentally competent, may not be coerced, may not have access to high quality palliative care. And all of these things that you can't properly safeguard against don't apply to her. So she's looking at it through a very narrow vision. But I really respect Wes for changing his stance on it. Like he voted for it in 2015, but he's got the guts to say, I've changed my mind and I'm looking at the state of things in this country, and now it's not the right time to do this.
And it's so important. Look, you're much closer to it, Fleur, but I just can't see there's any way this is going to pass now that Wes Streeting says, look, the NHS clearly can't cope. Amy, I have a bit of an issue with the Esther Rantzen thing, though, because I don't know if you remember this, but I'll play it to you. She appeared on my GB News show during the COVID pandemic, my former GB News show, I should say, during the COVID pandemic, and made it clear that she wanted the NHS to deny life-saving treatment to anyone who would not be vaccinated with the COVID jab. So I'll get your reaction in just a moment, but this is a reminder of what she said at the time.
A vaccine or a booster, then you can decide not to go to hospital however ill you get. And that way, that is your right.
So you would leave the unjabbed at home to die if they had a heart attack, if they suffered from a stroke?
That's their choice. If they're unjabbed, if they take the decision they're not going to use the medical evidence, follow the science, as we say, recognize, because what the boosters do is not only protect you, they protect other people, because you transmit the infection far less.
Yeah. Although you can still transmit even if you are triple jab.
So, Amy, I just find, given that previous position, it's very odd that Keir Starmer has put her on some sort of moral pedestal and said, I'm delivering this vote for Esther Rantzen, given Esther Rantzen wanted to deny life-saving treatment to people who wouldn't follow her view on the COVID jab. But first, we've partnered with Gundry MD to share this information with you. Would you believe me if I told you inside your pantry right now is one of the healthiest foods on the planet? Yes, it's true, and it's not some weird, trendy superfood. Spoiler alert, it's olive oil. You've probably used to cooking with it, but there are countless ways to use olive oil to help yourself look and feel younger. For example, olive oil is a natural way to help you achieve a more youthful appearance. Besides helping you look younger on the outside, it's a fantastic tool for your insides as well. According to Dr. Stephen Gundry, a famous cardiothoracic surgeon, nutrition expert, and health advocate, you should get as much high-quality olive oil into your daily routine as possible, whether it's taking a shot of it daily or keeping a bottle of it in your bathroom medicine cabinet. But what kind of olive oil is best for your health? Well, any olive oil can give you some benefits, But if you're looking to get the best results, it matters a lot which one you pick. The olive oil industry is huge, you see. You can tell by the number of olive oil brands you can see at the grocery store, and you can bet they're not all made with the consumer in mind. And many brands may even cut corners one way or another to increase profits. When Dr. Gundry came to that realization, he was appalled. But some olive oils are so powerful, it may only take a few tablespoons a week to see these incredible health benefits. So how can you tell between an olive oil that can be a health booster and which one isn't up to par? Well, in an effort to answer that question, Dr. Gundry has decided to take a stand and release his personal research and findings. This video has gone viral since its release, and it's important you see it so you can start benefiting immediately. So you can watch the video right now by going to getolive1.com/outspoken, or you can just click on the link in the description box below. So that's getolive1.com/outspoken, or you can just click in the description box below on the link. People who have taken his advice have shared their results with him, saying the olive oil they bought after learning his simple rules have helped change their lives. So make sure you go to getolive1.com/outspoken or click on the link in the description box below this video. But now, back to the show.
It is utterly self-centered. It's such a spoiled, self-centered way of looking at things. And like Fleur said, I'm very proud that Wes has actually been quite courageous with this, because I think we can all think of a time or a personal or a personal moment where we've known someone that could do with assisted dying, but has had to go through with it a normal way because it's not available. But when you step back and look at the bigger picture, you can understand that it is important that we keep the laws that we have around assisted dying. For the benefit of the more vulnerable people who could have been it used against in a very sinister way, as you're seeing in Canada.
Well, indeed, and it's really important that you mentioned that, actually, Amy, because I've got this video from Stephen Edgington of GB News, who interviewed a disabled woman in Canada who said that she was actually offered euthanasia. So this is the problem, and it's why a lot of high-profile disabled people are saying, no, this could be used against us. So have a look at this.
You're not going to give me the equipment we need to live, but you're just going to help us die? Like, what is this? I served 10 years with Canadian Armed Forces and then 10 years as a para-athlete for Canada. And as I am waiting for medical equipment and an elevator for my house to be able to transfer, it's been over 6 years now. It's still not there. And the agent treating my file told me one day when I told him on the phone that I just couldn't go on anymore. It was just, unbearable, and it's just too hard. And he told me, if you really think you cannot keep going on and you find it's too hard, you have the right to die. So there I am fighting all this time to trying to just get the proper equipment to just want to be able to live a life with the minimal of autonomy and independence. I understand I have still all these limitations, but it's ridiculous because from the states of things, I could probably be dead in 2 weeks.
Fleur, I mean, an absolutely heart-rending interview there from Stephen Edgington. And you can understand why Tanny Gray-Thompson, for example, has come out against the assisted dying legislation.
Yeah, the first time I watched that interview with Stephen Edgington, I was crying because this is a veteran, this is a Paralympian, this is someone who has done amazing things with her life. And just so easily a doctor who takes an oath to protect life will say to her, you can die in 2 weeks. And, if in certain circumstances in Canada, it can be 48 hours. So it's just, what value do we put on human life at this point when, what is it? A chairlift or death? That's it. That's your choice. Obviously, our NHS is in a shocking state. And how quickly is it in Canada? It was 5 years before it was taken from terminally ill only to what they've got now. And just the slippery slope is slippery and steep. But there's heartbreaking stories.
Yeah, no, indeed. And we have to care about the sanctity of life. Well, look, we've covered it all today. Thank you, Bombshells, Fleur, Elizabeth, Amy, Jemima. Their brilliant podcast, which features interviews with the likes of Guido Fawkes, the aforementioned Stephen Edgington, and Toby Young, is available now on YouTube. Great to have you both on Outspoken today. Thank you so much for watching Dan Wootton Outspoken. Please click on my face just to the bottom left to subscribe to this brand new independent news source and turn on the notification bell so you'll be alerted to our brand new live shows, uncancelled interviews, and special royal episodes. Outspoken is also now available as a podcast, so you can listen to the show every weekday on the go, wherever you are.